Good afternoon, everybody. I'm Dawn Genvy, and I'm a research manager in the Patient and Public Involvement team at NIHR. Welcome to the third in our PPI in Action webinar series. Today's presentation is focused on involving children and young people in an evidence synthesis around prevention of childhood obesity. Before the presentation, I'll run through some general housekeeping rules. Next slide, please. You can enable closed captions by clicking on the CC button. Next slide, please. And if you'd like to ask a question, please click the Q&A button. You can select Send Anonymously if you do not want your name displayed with your question. Once you've finished, remember to click Send to submit your question. The questions will be answered at the end in the Q&A. So without further ado, I'm delighted to now hand you over to Professor Julian Higgins.
Good afternoon. Let me introduce the team before we get started. My name's Julian Higgins. I'm Professor of Evidence Synthesis at the University of Bristol. And I was the PI on the project that we're going to be talking about today. Lucy?
Hi, everybody. I'm Lucy Condon, and I'm the Public and Patient Involvement and Engagement Facilitator for the Applied Research Collaboration West, which is a bit of a mouthful. And I also co-run the Bristol Generation R Young People's Advisory Group, or YPAG. And we're very lucky today to have two of our YPAG members involved, Elizabeth Sheldrick, who can't be here in person, but has recorded some segments for us, and Maddie. Maddie, would you like to introduce yourself?
Hiya, my name is Madeleine Coleman. I'm 19 and I'm currently in my first year at the University of Leeds studying maths and economics. I've been part of YPAG for the last 5 years now, so I've been involved in quite a few different research projects. And this specific project that we're going to talk about today, I've been on for the last 3 years, so a decent while. I think I'm handing back to Julian now.
Thank you. So I'm going to tell you a little bit about the project to get us started. You can see the name of the project at the top, Evidence Synthesis for Components of Childhood Obesity Prevention Effectiveness, or a scope. I'll explain what we were trying to do very shortly. But first, a couple of acknowledgements. First, to thank NIHR Public Health Research Programme for the funding. And secondly, to acknowledge that this is a big team working on it. Most of us at the University of Bristol, but we had collaborators in Durham, Bath, Copenhagen, and down under in Newcastle, Australia. So we were interested in interventions to try and prevent children, young people between the ages of 5 and 18 from gaining excess weight. We know obesity is a massive public health problem these days. Lots of things have been tried by many people, as you can imagine, and we wanted to try and work out as best we could what types of interventions are most effective. And as a secondary aim, we wanted to know whether the kind of starting point of the children in terms of their BMI is a reflection of their weight, or their characteristics typically associated with inequities, such as a socioeconomic status, their educational status, their ethnicity, and things like that, whether they influence the extent to which an intervention is effective. Ideally, we want to reduce the inequities that there exist in obesity, but what we certainly don't want is for these interventions to increase those inequities. So we wanted to understand that. Next slide. So, how we went about this project. It was an evidence synthesis project. So at the core of it were systematic reviews. And we began by updating a rather old Cochrane review of interventions to prevent obesity to find all of the randomized trials that had been done to examine the effects of these interventions. And we identified over 200 trials during that. To understand which of the many interventions studied in those trials might be the most effective, we developed what we called an analytic framework, which is essentially just a collection of hypotheses about what characteristics of those interventions we think are likely to be associated with greater effects, bigger impact in preventing this excess weight gain. So we did a lot of work to develop that framework. We then, of course, had to code all of these trials and all the interventions in these trials according to these characteristics, so that we could do our fancy complex statistical analysis to look at, in a very complex data set with various hierarchies, whether these characteristics are associated with greater or smaller magnitudes of effect. And of course, we had to interpret what we found and draw some conclusions. So we're here to talk about, next slide, please, Lucy, the involvement of the children and young people in this project. Going back to the very beginning, when I was preparing the funding application, we had our first meeting with some school attenders. It was just on the day that we were supposed to stop seeing each other. The deadline was the day after the formal lockdown started. So we were very lucky to have a face-to-face meeting. In fact, the only one we've had in this particular project. And we talked to them about what we wanted to do, and they gave us lots of great ideas about how we might explore the data. And they gave us a particularly strong steer about the importance of separating the primary school age children from the secondary school age children, which became a central part of our data analysis. It was clear that talking to these sorts of people was going to be hugely valuable right through the project. So we laid down some plans to involve them in many stages, as we'll talk about. Because, I mean, clearly, these are the people who understand what impact these interventions might have on their behaviors, which is really what we're trying to do here. So what we're going to talk about today, in the next slide, is the different ways in which we involve the children and young people. We'll talk about how Maddie and Elizabeth were full members of our project advisory group from start to finish. We'll talk about the sessions we held with children and young people to develop the analytic framework I mentioned, how we involve them in actually coding the interventions. I mean, one of the things that came through very strongly in our discussions was interventions. They've got to be fun things to do, and who better to code whether an intervention that's described in a trial report is a fun thing to do? Well, the children and young people themselves. So we had a big bunch of them actually coding this, and you hear about that from Elizabeth. And then we involved them in looking at the results to try and help us interpret what we saw. So we're going to talk through these things, but before we do that, Lucy's going to give us an introduction to this YPAG, Young Persons Advisory Group, that we've mentioned already.
Amazing. Thanks, Julian. So yeah, we keep mentioning a group called YPAG, and I just thought I'd give you a little bit of context, and so you can hear a little bit more about them. So when we talk about YPAG, we are talking about Bristol's Generation R Young People's Advisory Group. And this is a public and patient involvement and engagement group of young public contributors aged 10 right up to their early 20s. And this is a group of young people who are interested in contributing to health and care research. The group is currently run by myself and my colleague Eva Roberts, but formerly I co-ran it with my colleague Mike Bell, who's now retired. And I'm just mentioning that because Mike's name might pop up throughout. So if you wonder who we're talking about, that's Mike. The Bristol Young People's Advisory Group is part of a alliance called the Generation R Alliance, which was a national initiative set up by the National Institute of Health and Care Research. And currently, I believe I'm right in saying there are 25 young people's advisory groups that form part of that alliance, and they're all over the UK, both England, Scotland, and I believe Wales as well. The Bristol YPAG is one of the larger groups in the Alliance. So we've just inducted some new members. So now we have just over 90 young people working with us. And the group covers a really wide range of public involvement activities, from your more traditional idea of public involvement, so kind of one-off sessions where they're working with a researcher to maybe focus on something very specific, like a study questionnaire or perhaps participation materials for studies, right the way through to far more in-depth involvement opportunities, where young people can get involved in studies from the very beginning throughout and get quite heavily involved, which is like the study we're going to hear about today. And we will make sure that these slides are shared afterwards. So I've put a link to our group in these slides that you can follow, but we'll also have other links that we might mention along the way that we'll make sure are shared after that. So hopefully that gives you a little bit of background. But now I'm going to hand over to Maddie and Elizabeth to tell you about how they and their peers at YPAG helped Julian and the team within this study. So Maddie, over to you.
Thank you very much. So to start off with, the project advisory group that Elizabeth and I were part of, it was made up of a very diverse set of 7 experts, each with a different speciality. So they had obesity research, evidence synthesis, statistics, and then it was Elizabeth and I there as the young people's experts, you can say, as our role was to guide and advise in the study, providing input just from multiple perspectives, as the young people's perspective is crucial to ensure the research is comprehensive and relevant to young people. So one of the key factors that made these meetings work really well was our chair, Jeremy Grimshaw. So he was so supportive, and we had pre-meetings for every formal meeting where he would go through what the meeting was going to be about and maybe some language that was used in it that we potentially don't understand, and then maybe materials as well. So these meetings were really good because it meant when Elizabeth and I came to the formal meetings, we knew what was going to be going on. We felt like we could provide input and we knew what we were talking about, and that our opinions were just as relevant as the other experts on the group. So that was really good before the meetings. And then when we were actually in the meetings, we had Jeremy being great and using the private chat function by messaging us, making sure we understood stuff. If maybe like an abbreviation came up that we potentially just wouldn't know, he would just ensure that he sends a little private message to make sure that we do understand. And this was great because it allowed the meetings to still have the technicality that they needed to have to be useful, but it also meant that Elizabeth and I were understanding what was going on. And this was really crucial because although Elizabeth and I maybe didn't input as much as the other experts in these specific meetings, it meant we understood what was going on. We understood the goal of the project, we understood how it was going to be carried out, and that then meant we could feed into other areas of the study that we're going to talk about now. So I think next slide, please. Cool. So the PPI sessions to help develop the analytic framework were run with 2 sets of YPAG members. So first of all, they had just YPAG members on their own, and then the second one was conducted with their parents involved as well to get a more family perspective on the research. And these were vital in shaping the direction of the study. So they were carried out quite near the beginning, as you can see on the research cycle chart here. It's super crucial to have them shape how the research actually is conducted, and instead of just adding it in halfway through as oh, we could do this, but no, like you need to start from the beginning and make sure that young people's views are at the center of this and carried out throughout. So these sessions gave young people a platform to share what they felt was important, and it was just gave a wider range of people to suggest different aspects, such as the fun factor that came out of this, which I think we talk about in the next section because that was everything that they coded, but that came out of these groups. So that was super, super helpful. And me and Elizabeth actually met with Julian, who ran these sessions, before he went to run the sessions, because we've been on many, many research meetings just like this with researchers where they're asking you questions. So we know what works well and what doesn't. So we help Julian with the language he uses and how interactive it's going to be. And that was super helpful because to be on the other end of planning one of those sessions, I think it was good to ensure the communication remained well throughout.
Amazing. Thanks, Maddie.
Elizabeth now. So
just before we move on to listen to Elizabeth, I just wanted to highlight the diagram that Maddie has mentioned already on this slide, which was actually produced by our YPAG members and one of our adult public contributors, Louise Ting. And we will share the link again to this infographic and some supporting materials. As it can be a really, really helpful tool if you are thinking about working with young people or just public contributors in general throughout your practice, and really thinking about involving them at every stage and not just, as Maddie says, partway through. Thanks, Maddie. So now we'll hear from Elizabeth.
Hi, I'm Elizabeth, and I've worked with Maddie and Julian on this project for the past 5 years. I'll be talking about how a key aspect of this project, the fun factor, came from the PPI meetings. This was where the Young People's Advisory Group would rate extracts from papers on how fun they were through a questionnaire. Each young person was sent a collection of 10 extracts from previous papers, which would describe an intervention. Then we filled out a questionnaire rating how fun we thought they were and how appealing they would be to specific age groups. Like all other YPAG meetings, those who did the ratings volunteered to take part. Overall, 35 young people rated the extracts. There were a variety of opinions on how fun we thought each intervention would be. One example of an intervention was the children were given sports equipment to play with. YPAG members would then rate how fun this was. This unsurprisingly scored higher than the intervention involving the children being given vegetable seeds to grow in their garden and then eat, improving their diet. The coding and rating of the fun factor was key to the project, as it was used in the analysis to see whether interventions that YPAG members coded as more fun were better at preventing obesity. Additionally, myself and Maddie were involved in further PPIE meetings to look at results of the intervention analysis. As well as this, the results were sent to YPAG meetings, where the young people were able to help Julian and the researchers interpret them. This was particularly useful when the results were not what they had expected. This also gave myself, Maddie, and the YPAG the opportunity to hear the results, which was so important. YPAG often feedback that we want to hear how our input has shaped the research, but it doesn't always happen. It really helps us to feel valued and understand how our input has helped the researchers and their projects. As well as this, I helped to share and disseminate the findings from the study at a meeting of experts, including teachers and members of the local council. In this event, the research team planned to pull together key stakeholders, such as people from the local council and other experts in interventions in childhood obesity. I presented about my role in the study and fed back the YPAG's understanding and interpretations of the findings. As well as this, adult public contributors from the world of teaching also fed back on their peers' interpretations. This was a key area of dissemination, and it was important to get the YPAG's interpretations of the findings across, and it was great people could hear that from a young person.
Thank you, Elizabeth and Maddie. Hopefully that's given you a really great overview of how they and the rest of the YPAG members got involved in this study. But we just wanted to, after hearing about what happened, spend a little bit of time reflecting on how we found the process, what we felt worked, areas we felt could be improved. So I'll move on to the next slide and hand over to Elizabeth.
Finally, through this project, we have all learned a lot about PPIE. Something key that we have learned is how important communication is. To ensure your public contributors and young participants feel included and part of the team, it's important to keep everyone in the loop through consistent communication. Emails and WhatsApp messages are a much quicker way and often help to maintain communication better than Zoom calls. However, a meeting every now and then to catch up and discuss progress is good too. We did this by having a dedicated contact. Mike and Lucy were there to act as the main contact for Maddie and I. They provided extra support, someone to ask questions to, and a friendly face, which is always nice when you're first meeting a researcher. We also had a dedicated pre- and post-meeting catch-up when needed, allowing space for us to get to know each other better and for Maddie and I to feel comfortable to ask any questions and generally feel welcome. Also, if you're planning on including PPIE in research, we would recommend having more than one public contributor or young person involved, as that definitely helped our confidence from the start that Maddie and I were involved together. Now I'll hand back over to the team to let you hear what they think.
So Elizabeth, I think, has picked up on some really great points there. I just wanted to build upon her last point about the importance of having more than one public contributor involved in your study. It worked incredibly well within this, having Elizabeth and Maddie able to kind of peer support each other and work together as a team. We've also been involved in other studies with YPAG, where we've had even larger groups of young people working together in very, very similar roles, groups of 5 or 6 young people. And I would say that that has been perhaps even more beneficial. Not only does it really, really help, I think, with that kind of feeling of being part of a team and creating even better peer support, and hopefully ultimately making it slightly less intimidating, force in numbers and all of that. But also I think it's worked out as being quite a beneficial thing for researchers, not only in terms of having a broader input from young people, but also I think understanding, you know, when you have members of the public involved in studies that go over a long period of time, a lot can happen in that space of time. Life happens, people can't always stay involved throughout, and having a larger group of public contributors that you're working with means that you don't have to then restart everything over again. You've got that continuity throughout, which has proved very beneficial. But Julian, I'm going to hand over to you for the next one.
Thanks. So I just wanted to make the point that from the kind of research PI's perspective, one of the things that made this what I think was a wonderful success story in terms of our PPI was, and I guess not everyone's going to be quite this fortunate. We had a kind of double whammy of both dedicated people in Lucy and her predecessor Mike, who were overseeing PPI activities in our local ARC, which this project was connected to, and they had this YPAG as a fantastic resource and a way to get young people engaged in the project. So I've been involved in a number of evidence synthesis projects with PPI, and none of those have been quite successful. And a large factor in that has been the dedicated resources in those two ways. So.
Thanks, Julian. Maddie, did you want to come in?
So talking about saying thank you and giving reassurance and how important it is that the public people you're involving in your research know that they're not just there to check off a little tick box for you guys, and that is actually crucial and it does make a difference. For us, Elizabeth and I, we were definitely that we got reassured loads. They made sure we definitely felt appreciated and that our opinions were valued, and that makes you more engaged. It makes you want to say more and put more work into it because you know they're actually gaining stuff out of it. So that's super crucial. And then making it fun as well, because well, personally I loved it. I was like 16 when I got the opportunity to be part of this, and I was like, Mum, I'm on a project advisory board, like that's so cool and beneficial. But fun carries on to all of the smaller research ones. For example, the meetings with Julian and young people to get the analytic framework, making them more fun and interactive and in a better style means your young people are going to engage with it more. They're going to want to help out. Their opinions are going to come across better. It's just kind of at the core of everything we do in YPAG. I think it comes out of a lot of meetings. It came out of this one with the fun factor. Yeah, it's just a really good thing to make it interactive, I think. And then Lucy, I think it's back to you.
Thanks, Maddie. And I think you're very right. It's definitely important to try and make things fun for everybody involved, not just the young people. And I think off the back of that as well, in terms of thinking about fun and saying thank you and giving reassurance, it's a really important point not just to think about how what you can be getting from your public contributors, but in return, what you can give to them to say thank you. And again, it will add to that feeling of feeling valued. So, I mean, one of the most obvious ways of that happening is thinking about reimbursement. And we do make sure that we pay all our public contributors, whether they're young people or adults, but also thinking more outside the box. In terms of fun, I mean, we've spoken about that a lot. Can you have social opportunities to build those connections and relationships between people? What is helpful for the young people that you're working with? Are they about to go to uni? Can you help with references, getting applications? Can you offer work experience opportunities? And also, would training be helpful, not only in terms of the study that you're part of, but also anything else that they might like to help them with their own personal development? This next one is one I'm sure we can all relate to, but it's very important to budget properly. Julian and his team did a really good job at not underestimating the resource that they would need to make sure that their public involvement was really valued and really done to the best of its ability during this study, but it doesn't always happen. And there's no harm in asking. When you're putting in these funding bids for things, I think it's always better to try and think about the most grandiose opportunity that you might possibly go for in terms of your public involvement. Partly because it shows how dedicated you are, but partly because you never quite know what's going to happen. So planning as much as you possibly can is great, trying to think of all the different costs, not just reimbursement, but thinking about all eventualities, whether it's if you're going to need public contributors to read over documents, attend pre-meetings, travel, venues. Are there going to be any accessibility needs that you need to take into consideration and try and support? Also training, but also I can guarantee you there will probably be something along the way that you won't have thought of. And if you are being flexible and responsive, which is something I'm going to come on to in a minute, which is a very important way to be, I think when you're working with public contributors, you need to have the flexibility within your funds as well and try as best as you can. And I know it's difficult to try and accommodate for that. This next one, I'm sure, will ring bells with a lot of people, but just try and give yourself as much time as you possibly can to plan, but also to spend with your public contributors. I know time is scarce for all of us, but if you can try and carve out as much time as possible, there's no two ways about it. The more time you take, the better the public involvement will be. And a great example of this is the fun factor coding that we've spoken about in this presentation. I think it was such a fantastic example of seeing how a research team could be flexible and responsive to what their patient and public involvement team, patient and public contributors were bringing to them. And Julian and team did an amazing job of taking on board what Maddie, Elizabeth and the rest of the YPAG were saying, and were really responsive to that, not only taking on this idea of coding a fun factor, but then also getting the YPAG members involved in actually being part of that process of coding and figuring out what was fun. But it was something that came out of the blue. And it was something that we were kind of doing as we went, learning as we went. And I think we did a very good job. We definitely had to change things as we went. But I think retrospectively, if we were going to do something like this again, we would probably plan in more time into the planning of that, have more space beforehand to actually approach people about the process of going through that coding and making sure it's as succinct and works as well for them as possible before then undertaking that. But it was a great opportunity, and I think sometimes just doing things can be the best way to learn. Yeah, and like I said, I think as in all patient and public involvement, just being flexible and responsive is one of the most important things to bear in mind. And I say this time and time again, and I will say it forever, but just try not to make any assumptions, whether that's in terms of your research and what you think people are going to say and comment on, but also in terms of how they want to get involved. Always just ask people, how do they want to get involved? Use your infographic of the research cycle and present options to them. And you never know what you might learn about people's backgrounds and knowledge and how they might be able to help you. And then this last one, I hope Julian doesn't mind me putting this in, but I counted it as a big win. I think it's safe to say, Julian, that you were maybe not completely skeptical, but a little bit skeptical about having public involvement, particularly within an evidence synthesis review. But I think, is it safe to say that we maybe converted you there?
I'd say I'm converted to an extent, absolutely. Yeah, I had no idea when we embarked on this how much fun and genuine meaningfulness, which is probably not a word, we would get from the involvement of the children and young people. And I've been absolutely bowled over by how it's all turned out. I maintain a little bit skeptical that every single evidence synthesis needs this, but on this occasion, it became very clear that it was an essential part of our work. And that really has converted my attitude towards PPI to a very large extent.
Well, I will consider that as a big win. Thank you, Julian, for being so honest. So thank you, everybody. I think that's the culmination of our presentation, but I'm going to hand back to Dawn, who has been looking after the Q&A, and we're going to answer some of your questions.
Thanks, Julian, Maddie and Lucy. That was a brilliant presentation, very informative, with some really good key sort of messages there about how to approach PPI. So thank you. We've got some questions, so I'll just run through them quickly. So the first one, how diverse and representative are the YPAG groups? How have you been able to make these groups accessible to young people from underserved groups?
Shall I take that one? Probably makes the most sense. Yeah, really, really great question. So as I said, we do have a particularly large YPAG group, larger than a lot of other ones I'm aware of, with just over 90 members. And the group itself has changed a lot over the years. So it's over a decade old now. And I think my predecessors wouldn't mind me saying that it hasn't always been that diverse. When it first started, it was very much came out of an organic need and around some specific research needs. As has historically maybe been the case, it ended up being a lot of children of researchers and other academics, people that the team who were putting it together kind of knew, and wasn't very diverse and representative. However, we've done a lot of work over the years, and actually, in a weird way, COVID has kind of worked quite well for the group, in that prior to the pandemic, we were in a way running a much smaller operation. We had a lot fewer members, under 20. We were meeting 6 times a year for in-person opportunities, and didn't really have capacity to do much more than that, particularly doing things in person. However, when the pandemic hit, we had to figure out how to move everything online. And now we run our YPAG in a far more ad hoc basis. So we tend to do sessions and create opportunities as researchers come to us, rather than having set times of the year when we do things, which means we've been able to broaden our membership in number, but what that has also meant is in the diversity. So me and my colleagues have done a lot of work going out into the communities, speaking at schools, speaking at various community groups, young persons groups, really spreading the word, and getting our young people to go out and kind of present about things as well, so that young people can see what you can get from it. And it's really helped us get a much more representative membership that represents the city and the patch that we live in. So I hope that answers your question.
Thanks, Lucy. The next is, this adapted research cycle is brilliant. Would it be possible to adapt this, tailoring it for communities underserved by research if the original source is credited?
Oh, that's a very good question. I mean, anything's possible, I guess. I would imagine so. Feel free, please, to get in touch with me about that. I'll make sure that Dawn has my contact details to share. And I think ultimately it would probably be up to our public contributor, Louise Ting, who designed it. But she has done an amazing job. We've also got a version of it for working with adult public contributors. And I know that there has actually been previous conversations about maybe converting it more to working with community groups. So maybe something that's already on the cards. But yeah, that's a really great idea. Please do feel free to get in touch, and we can take that further, definitely.
Thank you. The next question is, sorry, it's just gone down to the bottom again. Really impressive to see 90 members in Bristol YPAG. I wondered how you ensure individual voices can be heard amongst such a large group. It can be difficult to ensure everyone gets a say, particularly given group dynamics like younger YP versus older YP.
That is a very good question, and very valid. And I think it's very rare, in fact, ever, do we have all 90 members involved in something at the same time. I think that would be incredibly difficult to manage in terms of ensuring that everybody's voice was really heard. So how we run our particular YPAG is, like I say, on this more ad hoc basis. So a researcher, for instance, will come with us with a particular thing that they want the group to comment on. We then have a mailing list of our 90 members. We will do a call out for that opportunity, and people can put themselves forward to it. So when Elizabeth talks about volunteering for opportunities, that's what she means. There's no onus on our members to sign up to everything or take part in specific things. It's entirely up to them what they put themselves forward for. And numbers will change a little bit, but generally speaking, particularly for our sessions, we probably have between 6 and 8, sometimes a little bit more, involved in those, which is far more manageable. And yeah, so it's a bit more fluid. As of yet, we haven't had all 90 members commenting on one thing. I think that might give me nightmares, but anyway.
Thank you. So somebody has put, if this isn't explained during the presentation, it would be good to hear about the training the young people received on the coding, or more about the training that the young people received on the coding.
That is a very good question. Julian, would you like to come in?
I should take that one. So, I mean, we work with Maddie and Elizabeth to plan the form of the process, and that's my recollection anyway. We came up with, we didn't really need to provide training, I don't think, and they took to it hugely well. We provided, for each of the interventions we'd identified in the trials, a short snippet describing it, pulled out of the paper. Because there were 250, we didn't have time to rewrite them all in plain language. So we did have to kind of hope that they could make the best that they could of those. And we gave them a very simple survey that just asked them to answer 2 questions, basically, on a 5-point Likert scale, from really boring to really fun. The first one was, what do you think of this? And the other was, what do you think typical children in the age group targeted would think of this? And we didn't feel there was any need for training. Lucy.
Can I come in on that? Thank you. So just so to give a bit of context as well, the turnaround for the coding activity was relatively short, and I think if it was something we could redo again, we'd probably make sure that we had more time to kind of bring everything together. So we ended up, as Julian said, kind of working in this way where we very much kind of tried to provide all information needed as we were going. And myself and my colleague, Mike, were available to kind of run through tasks with people, have little jump on Zooms and have little one-to-ones if anyone was struggling. And I think given the position that we were in, knowing the members very well, having already built up that relationship, that actually worked quite well, although it was quite time consuming. I think in retrospect, or if we were to do this again, what I personally would try and do were 2 things. One, have a kind of introductory training session for everyone involved that really just kind of would go over the basics rather than having one-on-one sessions. Also having them available if people needed them later on. But I do think also having the time and resource to have public contributors go through the initial extracts and try and convert them into plain English would be a very would have been a very beneficial thing to do. But we live and learn, and we'll do that next time.
Thank you. Next question is, you mentioned the importance of interactive ways to engage with CYP. It would be great to hear some examples.
The interactive ways of communicating, getting young people
engage with CYP.
Yeah. Maddie, I don't know, have you, as you're like a person involved in YPAG, are there any particular ways that you've interacted either in the study or various YPAG stuff that have stuck up in you?
I think this study, it's harder because it's obviously those meetings have to be formal, but with most of what YPAG does, they are smaller one-off meetings. A lot of the time they're fun by nature because it will be, I've been on ones about designing videos, designing posters, which is just by nature quite fun. But I think for the ones that are just interviews, that you're just trying to find out the opinions, don't make it a super formal meeting unless it really, really has to be. Keep it light, keep it chatty, make it as if it's just a friendly vibe. And although you might think you'll actually get less out of that, you get more, because if the young people are comfortable and enjoying the conversation, they're going to be more engaged, especially as you get some quite young people. Like, I think it's ages, I don't know how low it goes, Lucy, is it 5?
10.
10.
Mhm.
But I definitely remember being like 14 and with 10, 11-year-olds, and sometimes if it's just a bit dry and it's just question after question, a 10-year-old's not going to keep focused on that. And if you're adding materials, like colourful materials, pictures, simple language, it can just really help. Quizzes, game format, like what if scenarios, that just really helps, I think. Also, try not to send out too much. It's a lot of the time they send out like something for you to review and read before you come to the meeting, like a little briefing. And it's super helpful. That just make that a fun format, make it colourful, add some photos. If it's not going anywhere, if it's just to brief the young people, make that as fun as you can, type thing, I would say.
Thanks,
That's
Maddie. How do you advertise, recruit members? Is information about opportunities distributed across schools?
That's a great question. So distributing materials is probably something we do less of these days, just because we already have such a large membership and waiting list. But in the past, we have, through schools, definitely not only distributing materials through schools, but going into schools and speaking in assemblies. I think generally, just as a rule, in terms of getting members of the public involved in your research, the best thing to do is go out and speak to people. It's great to have resources, it's great to have flyers and all those kind of things, but if you can actually go and talk to people about what you're doing, go out to them, one, you show willing, two, it's going to be more memorable, and you can have those more engaged interactions. So I think, yeah, when we've been going through particular recruitment drives that have been the most successful, it's always been us going out, particularly with other YPAG members, so people can hear from the young people, not just from us old fuddy-duddies. It's always the most effective way to do things.
Thank you. The next comment, they've thanked us for the presentation, and they're just wondering what the resource allocation of staff time to support young people in the project was. And then there's a second part to the question: what recommendation would you give for the amount of time that should be put aside to do work of this nature?
So, shall I answer the first one, Julian? And then do you
Well, I'd also like to say something about the first one.
Okay, you go, and then I'll jump in.
Well, the PPI coordination time, which was Lucy and her predecessor Mike, it was actually a contribution from the local ARC West. We put an indicative amount in the grant application of 0.2% for the full 2.5 years, which is, I think, about 2 weeks full-time work. I suspect Lucy's put in a lot more than that. But the other thing I wanted to say is, so that was the dedicated coordination time. What we didn't budget for was all the work that the research team did, and in particular, Francesca Spiga, who I think is on participation here in the webinar, putting together all the forms for the coding, and there was a huge amount of work there. We were fortunate that she was full-time on the project for about 3 years, and just had to fit that into her workload, which had a great variety of review work and coding and you know, doing everything else and writing it up. Yeah, so that's what I wanted to say.
And what I was going to say kind of reiterates what you were saying, Julian, but I guess recognizing that we were in quite a unique or privileged position in that the study did have links to the ARC West that myself and my former colleague Mike worked for, and we have dedicated roles, particularly, and this is something that we've worked to get. It's not something that's always been. We've had to make a case for it, but part of my time is dedicated to working with the Young People's Advisory Group, which I know is not always the case, and quite often with PPIE facilitators, it tends to be kind of parts that are bolted onto roles, or you kind of end up doing around other stuff. So we are incredibly lucky in that respect, for sure.
Excellent, thank you. We've got one here that says, was the PPIE skeptic a YP, a parent, or an academic / clinician?
We answered that. It was me.
Yeah. Okay, so Maddie, would you be able to share how you have applied the skills you have gained through membership of YPAG outside the group, for example, at university for your career?
Yeah, of course. For me, I mean, I started at 14, so it was a very early introduction to researchers and professors. And over the years, I've definitely gained a massive insight into what working in research is like. I mean, I study maths and economics, so I have no idea how far into that I want to go and how long I want to carry on studying. But if I did decide to go onwards, although health research and like an economics maths research, it's quite different. At least this has given me a really great insight into the actual processes behind it. So that's super good. I've gained a lot of skills from it, I would say. Mainly communication. Communication's a massive one because you're constantly trying to communicate your views and your opinions and trying to help. You're working with a range of different people. Teamwork skills, just adaptivity to be able to do lots of different scenarios. And although these are great skills for me to have in general, I also, when I was 16 applying for my first job, I wrote them on my CV. Applying to university, it was in my personal statement a lot. And that's, I think, a really beneficial edge that people who haven't partaken in don't have. Also, as I progress to university, I'm in my first term, first year, but it's quite cool because there's some terminology that has come up and I've been like, oh, I learned that a few years ago, and other people don't really know what it means. Or, for example, one of my lead modules professors, he's doing a research study over the next 4 years, and I've chosen to be involved in it and get involved, and that's really cool because it's just, I'm interested in it and I find it nice. So yeah, that's what I would say I have gained quite a lot. It's been a really big part of the last 5 years of my life.
That's great to hear. Thank you, Maddie. A question for you, Julian. What converted you / convinced you of the importance of PPIE?
Well, I don't have much more to say than I said at the end there. I can't remember exactly when the question came, but it was, and it relates to one I can see is further down the list. Can I answer them jointly? Is that cheating?
Yes. Yeah,
This is
of
the
course you
one.
can.
Great that Julian was converted from Gary Hickey. I'd be interested to know what you would now say to convince someone else of the benefit. So it's kind of in the same area. And I think I would link back to something Maddie said, that it's understanding that these people bring an expertise that you might not have. So these projects I'm involved in, they're all multidisciplinary. Evidence synthesis requires, evidence synthesis, statistics, searching for papers, often clinical or public health expertise, and the expertise that comes from the people who are ultimately trying to do all this for the members of the public or the patients or the service users, and just to realize that they bring a perspective that is part of that research team, and if they bring that expertise, then you need to be involving them. And I think that asking yourself that question is key. I think there are some projects where I can't honestly say that I believe this brings another expertise. So we did an evidence synthesis very recently on the effects of sunlight. Everybody experiences sunlight. We did some PPI work, but it didn't really go anywhere. And I remain a bit skeptical that something as completely general as that, where we all bring that perspective, where going additionally to PPI, I'm not necessarily convinced that is as good a use of time as maybe some of the things you might be doing. I know people like Lucy may argue against me, but it's still my current view. But understanding where there is an expertise that you don't have, you need to incorporate into the team.
Thank you. If it cropped up, how did you deal with balancing different / conflicting opinions in YPAG groups?
I don't think it particularly cropped up in this study, but generally speaking, I mean, one of the first things that we do when we have new members joining us is speak to them about the kind of the group, I was going to say rules, but that sounds far too draconian, but the group agreement that we have about how we're going to act in the space and make that very clear. And that's something that YPAG members have fed into. So things like we make sure everybody's opinion is respected. We let everybody have a chance to speak. We comment on ideas. We don't make comments about people. Just kind of drilling in those boundaries, I suppose. I think we're very lucky in many ways. We've got an incredible group of young people who are very bright, very respectful of each other. And I'm actually really struggling to think of a situation where we've had conflicting views get to a point that's not respectful. And, you know, we always make it clear that we want our young people there because they are experts. We want their opinion, whatever that might be. Therefore, whatever opinion is being given is valid. So I think it's just really reiterating why you've got the young people involved, the importance of that, the importance of their voice, and the importance of respecting everybody else in that space.
Yeah, thank you. Next comment is, this is so interesting and helpful. Thank you. I work with another YPAG regularly and would love to include some of the older members in some more formal meetings occasionally with support. Maddie and others, any advice on recommended ages?
I would say it's not just the age you need to consider. You need to consider how much experience they've had in these sorts of things before, in other YPAG meetings or other public involvement. I think I was 16 when I started and Elizabeth was 15, and we definitely coped well. I think much younger than that, it might have been tough to understand some of the terminology. It's basic biology terminology that you just would spend more time. It could be done, but you would spend more time teaching and getting them to understand the technical terminology. So I believe 15 and above, but it is, we and Elizabeth have both had 2-3 years of experience by then, and I think that's what probably helped more. I think we both did have to apply and write a little bit about why we wanted to be involved. So I'm not sure how many other people applied. I'm not sure if you would have been part of this, Lucy, but it was definitely regulated and checked that kind of we did know what we were doing enough to be part of this. I don't think you could just pick a random 16-year-old who hasn't had any involvement in this sort of thing before, and I think they would struggle to cope with it. But yeah, so think about the age, and then also think about how much experience they've had working with researchers and stuff before.
Thank you.
Could I just add something?
Yes, yeah,
to that?
absolutely.
I think that's a really great point, Maddie, and I think something our YPAG members bring up a lot. I think people like to put young people in age brackets and assume that that means a set thing, but I think Maddie makes a very good point in saying it kind of is very dependent on the person, and not to judge by those brackets. But also, I think what is quite important is also talking to any young people that you're working with to try and find out what support they need, and rather than just dismissing people based on maybe an age bracket or whatever, really trying to think about what you can bring to support them in that role. And it might be, if you're working with younger people, they might feel more comfortable kind of having something like a separate young person's advisory group where they can be amongst peers but still discuss similar things, and then you can feed in between the two groups. But it's always worth trying to kind of think about what the building blocks are that you can put in place to make things happen, rather than just dismissing things because it seems like it won't be a viable thing to do.
Thank you. The household may have one food provider preparer, often one of the parents, especially for the younger age groups. Did PPIE include their opinion of the intervention?
That's a great point. Simple answer is no. It would have been great, although the vast majority of the interventions were school-based. And so the direct impact on that provider would be not that easy to work out. And a fundamental of our coding scheme, our analytic framework, is that we had to be able to code every single intervention according to that thing. And we didn't think of this, I have to confess, but thinking about it now, we might have decided not to do it on the basis that there was very little direct impact of the interventions on that provider, because it's about a lot about provision of school food and so on.
Yeah, thank you, Julian. How do I find out contacts for the YPAG group within Plymouth?
Oh, that's a very good question. So we've put together a bunch of links that Dawn's going to hand out with the slides and recording. And as part of that, I will make sure the Generation R Alliance website is included. And if you go on there, there's details about all the different teams and how you can get in touch with them. I can't remember off the top of my head if Plymouth is included, but it's definitely a good starting point.
Thank you. Do you need ethical approval to consult YPAG groups?
No. So it's public and patient involvement. It's not research. You're not including young people as participants. So technically, you don't need ethical approval. However, that doesn't mean that you shouldn't put things in place to and ensure that you are being ethical. For instance, when we have young people join our group, we do have a set application form. We do make sure we get parents' consent. We do make sure we do introductory sessions and give them a chance to find out about the group and what's happening beforehand. If we're ever working on any subjects that are particularly could be particularly upsetting, we always ensure we get extra parental approval and very much ensure that the parents are included when information is sent out and that they're in the loop. So although technically you don't need ethical approval, that you need to work ethically, definitely.
Thank you. And what payment incentive is approved? Was this a voucher?
Julian, do you want me to take this one?
You could take it, yeah. We pay directly. Oh, I've just taken it. We pay directly into their bank accounts, I think. Is that right?
Yeah. So we at ArcWest are very of the mind, and I know this can be a bit contentious, but that we pay our young public contributors the same as we would our adult public contributors, and we make sure that they are paid the recommended amount that NIHR suggests, which is £25 an hour. That can be done in various different ways, sometimes vouchers, sometimes via back transfer. I know from having this conversation multiple times with YPAG members that they definitely prefer back transfer and that they seem to love to shop vouchers more than anything in the world. But we kind of, it depends with which researcher we're working on, what the kind of payment is, but we always make sure that it's incredibly clear before anyone puts themselves forward for an opportunity what reimbursement they're going to receive.
Thank you. Had any of you been a carer of a family member, and did you have any children or young people who had suffered with obesity or been overweight on the YPAG?
So in terms of the second part of that question, we don't necessarily keep statistics and things about that kind of thing about our YPAG, but I just from knowing the group quite well, I'm aware that there were some people who would have fallen within that category. Yeah.
In terms of this project, it was about prevention of obesity. Had we been looking at treatment of obesity, then we would wanted to talk to such people, but we were more interested in preventing it happening. So we didn't explicitly seek those for our PPI for the project.
Would you like to carry on? There's 7 more questions. Are you happy to carry on answering the questions?
I can.
Yeah. Okay, so what fun, casual, enjoyable, interesting and interactive activities were suggested?
I wonder whether this means suggested for our PPI work or for the interventions for children to prevent excess weight gain.
Sure.
I'm sure I have a good answer to that one.
No, that's okay.
Trying another one.
Yeah, we'll move on to the next question. It's fine. And if whoever asked that wants to know more, then please email us. There's details at the end. Do you know if any of the parents went on to do more PPI?
That's a very good question. So we do primarily the sessions that we run are just with our young people, but every now and again we do run sessions either combining young people and their parents, or just parents. And I know that they have definitely gone on to do other things as a result of that. They kind of get their first flavor of PPI through the YPAG and through their kids and decide that they want to get involved. In terms of this study, correct me if I'm wrong, Julian, but it was just those one-off kind of YPAG children and parents session that the parents got involved in.
Thank you. Do you know if any of the parents went on? Oh no, it's the same one. Sorry. It's great hearing you talk about your experiences, Maddie. You talked about what has worked really well in YPAG, but I wondered what are some current aspects of YPAG you think could be improved, and is there space and support for you all to work on this?
I kind of wish Elizabeth was here to answer that, because over the past 2 years, I haven't been as involved as I was when I was young. I just lack of time. I've been out the country. This has been my main YPAG session, and for this study, I don't think it could have been improved anymore. The team was amazing. I felt all the support I ever need. Thinking about the previous ones I've done over a couple of years ago, I've never left a meeting feeling upset or unsatisfied or stressed. I've never had that situation where I thought, I wish that had gone a bit differently. I don't know if Lucy wants to add something. I personally think it works really well. I don't know if you've had feedback on how it could be changed or anything, but I just don't have an answer to that of how I think it could be improved.
That's lovely of you to say. Thanks, Matt. Yeah, it's a really great question, and I think it's something that we're constantly asking ourselves, and there are definitely ways it can be improved. I think it's changed a lot, even over the last couple of years, and both in terms of the group itself and the diversity within that, but also in terms of the kind of opportunities we're getting young people involved in, and more kind of more in-depth opportunities like this are cropping up, which is absolutely fantastic. It does get harder to do the more and more we have of them, because they are so time intensive, and there are only myself and my colleague who work with the group on part-time basis, both of us. So that is a definite challenge. So yeah, just having more support to be able to make things happen would be amazing. I think we're also doing a lot to try and develop YPAG having more ownership over the group, and it's something that can constantly be improved. But at the moment, we're currently working with some of our more long-standing members to create a peer mentoring scheme with newer members coming on board. I think something me and my colleague have talked about, which I know other YPAGs have done, particularly Gosh YPAG, is creating opportunities for older YPAG members who are maybe just thinking about leaving or wanting to change their role a bit, kind of giving them opportunities to take on facilitation roles and kind of training in that aspect. So I think there are lots of ways. We're always thinking about how we can kind of improve and change things and get YPAG more involved. So also, if anybody has any suggestions, please feel free to email them across. I'd be interested to hear.
Thank you. Is your team aware of any YPAG activity in Northern Ireland?
Oh, good question. Not off the top of my head, but I'm sure there is lots of really good stuff going on. And I would be happy to speak to colleagues and see what we can find out about other stuff going over there. So again, please do feel free to get in touch.
Great, thank you. And last question, how do you draw a line between PPI input and primary data?
Oh, good question. There's actually a really, really great diagram that sums this up, which I can give the link to Dawn for. I'll make a note of that. But I think primarily the difference is in, and feel free to jump in on this, Maddie and Julian, but are you working with people to help kind of improve the way you're doing things, or are you working with people so you can kind of work on them, or like kind of get information? I'm explaining this really badly. There's an excellent phrase that sums this up that my colleague would kick me for not remembering right now. But are you doing research about people or with people? I think is a good way to do it. So if you're doing PPI, you're doing research with people. If you're doing research with participants, you are doing research about people.
Yeah,
that answers that question.
yeah. Brilliant. Thank you very much. That's the end of the Q&A. So next slide, please. So thank you again for a really brilliant presentation, and thank you to the attendees for some really great questions there as well. Really appreciate that. I just wanted to say that there's an upcoming webinar on the 29th of January, 11 o'clock. There'll be an evaluation form that's sent after today's presentation, and there's a space in there where you can show your interest if you'd like to get the registration details for the upcoming event. So we'd really appreciate it if you can complete that and send that back to us. Thank you very much, everybody.
Thanks, Dawn.
Thank you.
Thank you. Cheers, everybody.
Bye.
Bye.
You.